Many changes in the substance use field are impacting how service providers do their work. For example, our knowledge of the neuroscience of substance use, the impact of stigma on people's wellness, and the increased collaboration of substance use teams with other health teams and providers.
In 20 years, I've never seen the field evolve as quickly as it is now. Even terms that we used a few months ago we're not using now. Even our very definition of what addiction is has changed. What medications are available to assist how we do detox.
During times like the COVID-19 pandemic, there is more urgency for people to be able to access substance use services.
I'm thinking about the way the substance use field and the issues that our clients are facing in the context of being isolated and not having as much access to services that they would normally have. It's required us to adapt very quickly to changing ways of delivering our care, to being redeployed, all kinds of things like that.
So, what can help regulated and unregulated professionals who work with people who use substances to navigate these pressures and to adapt quickly to new roles and situations? This video introduces an approach based on competencies to define job roles and manage change in the workforce. The competencies identify behaviors, skills, and knowledge required to perform job functions and work effectively. The Canadian Centre on Substance Use and Addiction has done the work of defining both technical and behavioural competencies for the substance use field. These competencies were developed in consultation with frontline staff, experts, and people with lived and living experience of substance use, along with their families and friends. Each competency is described with 4 levels of ability, from foundational to advanced. And competencies are suggested for 7 job clusters in the substance use field.
The competencies, because they were created in collaboration with experts in addictions in Canada, there's that confidence that they're really well informed and that you really don't have to reinvent the wheel by using them. They're so pragmatic.
They provide a baseline and standardization for organizations across Canada to be able to demonstrate these are the knowledge and skills that addiction counselors have.
CCSA continues to work in partnership with organizations as they apply and adapt the competencies to their own priorities and settings, and as they lead or respond to changes in the field.
As we're on the forefront now of perhaps having a new regulatory college and making addiction counseling a regulated profession in Alberta, it's been more important than ever to have those partnerships and to develop these competencies so that we could say this is the baseline for entry to practice all the way to advance of what addiction counselors do in Alberta.
We had been searching for documents that helped us to describe what competencies nurses needed in withdrawal management settings, and it was such a wonderful jumping off point to use the CCSA competencies as part of this work.
So how can you get started? Begin by reviewing CCSA's competencies and practical resources on our website. Then start a conversation about a competency-based approach with your team and work toward developing your own plan.
The field is really evolving, and if anything, the pandemic has just shown there's more need for addiction and mental health services than ever.
My hope is that other organizations adopt the competencies and use them for their purposes. We don't have a lot of time in healthcare, and whenever we can access something that is done for us and is done really well, we should use them.
For more information and updates, visit ccsa.ca and watch for upcoming videos about workforce development competencies.